to the the National Institute of Health, uh, chronic kidney disease is actually a significant public health issue in Ghana, affecting approximately 13.3% of the population, which translates to roughly 4 million. 4 million people. There are 4 million people who are working in Ghana, knowingly or unknowingly, carrying a chronic kidney disease. And that is why we're having this conversation this morning. The health minister actually mentioned it a few weeks ago. And that is our basis for this conversation, because we want to see you alive. We want to have you alive so that we can do all the things that we plan to do. And so my guests this morning are Dr. Charles Ahiagbe. He is a medical doctor and he joins me over the phone lines. I also have in studio Noah Kwesinate. He's a medical laboratory scientist and he's at the University of Ghana Medical Center. He's in studio here. Noah, you're welcome.
Thank you.
How are you doing, my brother?
Very well. How are you?
I'm well too, by God's grace. Good to see you.
Yeah, same here.
Yes. And Dr. Charles is also over the phone lines. Doc, good morning.
Good morning. How are you doing?
I'm well. How are you too?
I'm doing fantastic.
All right, great. Thanks so much for joining us this morning. Let me start in studio here, or let me start with you, Dr. Charles. Now, the health minister, like I said, recently indicated that about 4 million Ghanaians are battling kidney diseases. How serious is this situation from a medical perspective?
It's as serious can get. I mean, it's of public health concern now. It has become an issue of public health concern that requires, I mean, all hands on deck to solve it.
I see. Noah, let me also pick your thoughts on same. Why? I mean, how serious is the situation from where you sit? I mean, you also do lab tests and all of that, and let us understand from where you sit how serious it is.
Well, the situation is very serious. Looking at the numbers and the data that we have. So, if you look at our population, the nature of our population is a youthful one, and to have such a data, it means that most of this disease affects the younger ones, as we see now. So it is really of a concern and a public health issue.
Yeah. But why has it become a growing concern globally, and even in Ghana? Why is that happening?
Yeah. So as I mentioned earlier, things have changed over the years, and lifestyle is a major contributing factor when it comes to this very disease we're about to talk about. So things have changed. Things we used to do some 10, 20 years, 30 years ago are not the same things we do now.
Like what?
So as I mentioned, lifestyle, our food that we eat. Yes, these are contributing factors. So then if things have changed over the period, it should be a concern to the people of Ghana and the world at large.
Yeah. All right. Okay. Back to you, Dr. Charles. Are you still with us?
Yeah, I'm here.
All right. Great, Doc. So let us understand. So first of all, what exactly is kidney disease? But just before you even talk about the disease, what is a kidney? What role does it play in the body? And then what is a disease as well? Yes.
Oh, fantastic. So I would want to add to what my colleague said. You asked why we are seeing an increasing rise in kidney diseases in Ghana. Just to add to what he said, of course, hypertension cases are rising. You know, previously it used to be seen in 50, 60-year-olds. Now we see it in as young as 20-year-olds, 30-year-olds. And when the blood pressure is up that way, the kidney also takes a good beating when the blood pressure is up for a long time and it's uncontrolled. And then also the increasing rate of diabetes cases, right? What we call sugar disease. So the BP and sugar diseases contribute to a great majority of the cause for kidney diseases that we are seeing. And as my colleague rightly said, I mean, lifestyle changes, right? We are now relying largely on processed foods, high salt intake, I mean, poor exercise, just sedentary living. And then also the attitude of late reporting to our hospitals when there is a problem. And then also the widespread use of medications of unknown safety, right? Some being herbal. And then in certain parts, limited access to screening. So to come back to the question, you asked what the kidneys are. So there are two bean-shaped organs, okay, at the back of the abdomen, at the back of the abdomen, and what they do is they filter blood. So I want us to picture the kidney as a sieve, right? Don't think of it as the metal sieve you would have in the kitchen, but think of it as the sieve with a net, maybe the plastic one with a net under it. The net has the fine size, right? The fine space in between, such that substances you pour in, it would keep some in and then let some out, right? So that's what the kidney does. As blood flows through the kidney every second, every minute, it has to answer the question, or the body has to answer the question, do I need this? If I need it, then the kidney keeps it in the blood, right? It prevents it from passing through that sieve. If the body doesn't need it, then the kidney allows that to pass through the sieve and then get into the urine. I'm speaking in very simplistic terms here so that we carry everybody along.
Yeah.
So what happens when the fineness of that sieve or the diameters of that sieve is damaged? The sieves, the space between the sieve, I mean, becomes damaged. The sieves become wider. I mean, the net, the spaces in between, those fine spaces you have become wider than they should be, or the net separates from the plastic that is holding it, right? What happens that way? Then you'd realize that it will not be a sieve again, because virtually everything you put inside would do what? Would come out. Things you need would go through, would not go through the net and then be filtered out. And then things you don't need would stay in, right? So it just disturbs that balance that way. So that's what the kidney does basically. And then it does other functions too, right? So mind you, as I said, if the kidney has to answer the question, right? Do I need this? If the body needs it, it stays in the body. If the body doesn't, then it passes through its pores. Let's just keep it simply that way. So in doing so, it keeps the right balance of water, right, and salts in the body. So we don't become too puffy when we drink so much water, or we don't become so dry. I mean, when we lose so much water, right? Maybe you sweat or do something that way. So it finds a fine place, a fine balance in between all that. It also plays a role in blood pressure regulation. The kidney does that. It plays a role in blood pressure regulation, which is also very important, as we are saying that hypertension, uncontrolled, right? It's a cause of kidney disease. Also, the kidney gives certain signals, right, to appropriate cortex of your body to produce red blood cells, right? That in Ghana we say blood level, right? So healthy kidneys give appropriate signals to cortex of the body responsible for production of red blood cells to do that. So when the kidney is damaged, definitely it doesn't just affect maybe it's working, quote unquote, removing toxins. It also affects other systems, right? As we said, the production of red blood cells. And also, interestingly, the kidney helps the body in the production of vitamin D, which we know is necessary for the uptake of what? Calcium from the diet we eat, right? So when the kidneys are working well, enough vitamin D are produced, of course, in the place of appropriate signals. Enough vitamin D is produced, and that vitamin D helps the body take up what? Calcium from the diet we eat. And then that we know helps in the formation of strong bones and teeth. So in a nutshell, I mean, the kidney does a lot of other things, but in a nutshell, I want to keep it as that. Yes.
I see. All right. So it means that the kidneys are very essential in our life. So what exactly, can you explain the disease?
Okay. So as we lay the foundation for Kidney disease is basically the kidney not being able to perform its
Its
function,
function.
right? So its function, as I said, is to decide, right? The blood that is flowing through my sieve or the blood that is passing over this filter, does the body need this substance? Does the body not need that substance? So what is useful? I keep what is useful, and then I let go of what is not useful to the body. So when that balance is disturbed, such that it allows things that should stay and are useful to the body out, and things that the body should get out, it allows it to stay. We say the person has a form of kidney disease.
I see. But I understand that there are two. There's a acute kidney injury, and then there's a chronic kidney disease. What are the differences?
Okay, so acute, as it from the word, it's sudden, right? It's sudden. It could come about as, I mean, there are a lot of causes that could result in that, right? It's sudden, but often it is reversible. So somebody takes in what we would call a poison, or maybe that somebody gets severely dehydrated, or somebody gets a severe infection, let's say from malaria or something. Yes, for a moment, the kidney can lose its function, but when that offending agent is taken off, the kidney is able to recover at least to somewhat normalcy, and then perform its functions as or close to as it was doing before that insult occurred. Then with the chronic one, it is gradual, it is long term, and if not addressed in time, it becomes irreversible. It becomes irreversible if not, I mean, caught on time. So basically, acute, sudden, and sometimes, most of the time, it's reversible when the offending agent is noticed early and then taken care of. And then chronic, it's often silent, gradual, long term, and then irreversible, because by the time people get to know that is happening, then the kidney has lost, I mean, a great amount of its
Okay. Right. Okay. Let me bring in Noah now. Now, Noah, so you've heard, I mean, we've followed the conversation so far. What exactly are the causes of these things? And I know that globally there are causes, but I want us to look at Ghana. What are some of the things that we do, the most common ones that actually lead to these full kidney disease and all of that?
All right, thank you so much. So as my colleague mentioned, we have the acute and the chronic.
Yeah.
So if I should take it from the angle of the acute, as he mentioned, it's caused by something sudden, something momentarily. So for instance, maybe if you are taking medications, if you are dehydrated, poor intake of balanced diet, these things are some causes that can affect your kidney or bring about the acute kidney injury. So if you ask me of the causes, I'll take it from that angle. Now, when we take the chronic ones too, basically it is caused by either hypertension or diabetes.
Okay.
So these are some of the causes that factors that plays role in kidney diseases. Yes.
All right, Dr. Charles.
Yeah.
Are there any things you'd want to add to that? I want us to look at Ghana specifically. What are some of the things that we do, everyday things that actually lead to what we're talking about?
Okay, so as my colleague said, we can't say this enough. Uncontrolled hypertension, right? So the hypertension is that the high blood pressure is there, and then you are doing nothing about it, right? Maybe in denial or for whatsoever reason. Then diabetes, which is not controlled, not diabetes in and of itself, but if it's not properly controlled, there are kidney diseases, like diseases of the kidney itself, which may have genetic causes. And then what we see is the use of medications here of unknown safety, some of them being herbal, right? We take them and then we see somebody just move around with it. Oh, it does this. the medication solves this problem. It solves 1,000 problems. But the question we have to be asking is, or what we have to know is that, we have this assumption that if it's natural, it's safe. It's not it's not really so, right? It's natural does not necessarily mean safe, right? Think about it, right? Think about the the desert viper, right? Of course, its venom is natural, but it's nowhere near safe, right? And then
Yeah.
prolonged use of certain painkillers, which we find common, typically of the family called NSAIDs, what we know typically as Brufen, the Brufen family, right? I mean, we have people taking them back to back. Prolonged use of it takes a severe beating on the kidney. For some ladies, I mean, who have painful menses, they tend to, it's like their lifeline, right? For like 8 days in a month, they are on some Brufen.
Yeah.
It's harmful. It's really, really harmful. It's bad for the kidneys. And then imagine doing that maybe 2 times, 2 weeks a month for a year, and then the kidney would not be looking so good, right? So those medications too. And then if somebody goes to work, he's just having a headache. So we have to look into it, right? If you're having a problem that is causing pain, that you need pain medication for, you have to be assessed, and I mean, the condition has to be investigated, right?
Yeah.
And then it shouldn't be like we are applying makeup over like a wound or something. Let's get to the base of it and see what can be done. Just using painkillers, especially the Brufen family, broadly called NSAIDs, are problematic and are known to be harmful to the kidney.
How about the foods that we eat? Is there anything that has got to do with food that we eat as well?
If once the food, okay, fine. Once it contains something that would damage the kidney,
Like
then
what?
yes. So processed foods, highly processed foods, taken continuously over a long period. It's a whole chain, right? That is interconnected, leads to high cholesterol, further leading to damage of blood vessels. It's like a whole chain that is connected that way. And those substances themselves found there, I mean, if they are nephrotoxic, if they are harmful to the kidney, they'll damage the kidney and then result in kidney disease. So yes, anything that you ingest that has something that is harmful to you can damage
Can
the
damage
kidney.
too. All right. Okay. Do you have anything to add to that, Noah?
Yeah, so in addition to that, I would want to talk about our food intake. So you've realized that for over a period of time now, the late eating has become a norm. In the country. You go to joint in the evening, that's where you see people eating. And also these foods most of the time have high oil and fats, and we know what these oils and fats contribute to the body. They increase cholesterol basically.
Okay.
And as my colleague said, when it comes to the kidney is made up of nephrons, which these nephrons can be blocked by some of these foods that we take. And when it happens like that, it leads to it leads to the damage of the kidney. Also looking at high sugar intake, which can also lead to diabetes. What happens is that these sugars also block the flow of blood into the kidney, which in effect would also affect the kidney function. Yes.
I see. All right. So these are all things that we have to be paying attention to. I mean, we hear a lot of people say, oh, you have to check the time you are eating and all of that. And you are saying that is one of the reasons why people are actually suffering from kidney disease and all of that. Okay, let me just announce the phone lines in case somebody's listening to us and they may want to join the conversation. If you just tune in, you are free to do that. We're talking about understanding kidney diseases. We're talking about the causes, the symptoms, and also prevention. And my guests this morning are Dr. Charles Ahiagbe and also Noah. Noah is a med lab scientist, and he has joined us in studio for the conversation as well. You're free to send us a WhatsApp if you have any questions. 0544 321019, 0544 321019, or you can also call us on 030395661, 030395661, and then we give you the opportunity to ask your questions. We're streaming live on Facebook at ZFMGH and on YouTube at Z Multimedia. Please drop a comment there and we'll read them for you. All right, let's continue the conversation. Noah, so how can somebody know, or what are some of the early warnings or early warning signs really that people should pay attention to when it comes to kidney diseases?
Okay, so when it comes to kidney disease, the unfortunate thing is that more often than not, symptoms are very slow, and if not taken or if not checked at a health facility, you might not be able to catch it early. However, there are some symptoms that you can also take note of when you start seeing these symptoms. Should tell you that these are like likely signs of kidney disease. So first one has to do with frequent urination.
Okay.
Frequent urination. You visit the washroom more than the normal, and also swollen feet. Yes, swollen feet, what we call edema.
But that is when it has actually taken a long time, isn't it?
Exactly. So
or immediately it starts, your feet will get
no.
swollen.
So for edema, it's the long term. But conditions like frequent urination, fatigue are some of the symptoms that, like common symptoms that you would notice if you have a kidney disease. Yes.
I see. All right, Doc, do you have anything to add to that?
Yes, to add to what my colleague said. And I think I forgot to mention something with what is typical of our context here. Also alcohol use, right? Especially heavy alcohol use. It also places a stress on the kidney. Yeah, so just to mention.
Okay, sure.
That. So as my colleague rightly said, with the kidney, just like with high blood pressure, it's silent. That is the unfortunate part. For most of its course, it's usually silent. It hardly gives any, especially with the chronic one, right? With the chronic kidney, it hardly gives any sign of its inception. But then there are things that could be, seen. So as my colleague said, definitely you woke up with a puffy face in the morning, like swollen face. I'm not saying it means you have kidney disease, but it could mean you have, right? Fatigue. You are just getting tired more than you should, right? Or with the same activity, you are seeing yourself to be more tired and exhausted. It could be leading to kidney disease. Increased urination at night. You wake up a lot to urinate at night, or the amount of urine you pass has reduced. If you used to urinate this much, you drink maybe 2 bottles of 4 sachets of pure water, let me see, and then you realize that you've hardly peed a teaspoon. I'm just exaggerating, right?
Right. Yeah.
It should let you know that the filtration apparatus is not it's not working. But most of the time it's silent. Most of the time it's silent until it's really wreaking havoc. Then signs begin to show.
But at what stage do the symptoms typically become noticeable?
Okay, so there are stages to that, and it will not be a one size fits all. I'll stay for maybe stage 3 or this. No, it's not typically like that.
Okay.
So I think the conversation should be more around what should I do, right? I mean, I'm healthy, I feel fine. What should I do to to check my kidneys or to know that okay, the kidneys are doing well?
Okay. I see. But okay, so Noah, do you want to come in? Who is exactly at risk of these things that we're talking about and should be screened regularly? Which groups of people?
Okay, so gone were the days that you could, or I could readily say the aged. But due to the lifestyle, the change of lifestyle that we are currently seeing, any person is at risk. Youth, the old aged, like any person is at risk. So far as
so children can also suffer kidney disease.
Yes, the children can. So my colleague mentioned earlier that aside looking at the risk factors, genetics also plays a role when it comes to the kidney disease. So yes, it is likely for a child to
also.
Yes.
Doc, do you do you get people? Sorry, let me just bring in Doc. Doc, do you get people coming to you? I mean, even with children and all of that.
Yes, we see such cases. So it's a loop, right? As we tried establishing at the beginning, that kidney problems can cause high blood pressure, and high blood pressure can cause kidney problems. And when there's a kidney problem, it worsens the high blood pressure. And when there's a high blood pressure, it worsens the underlying kidney disease. So there are intrinsic kidney diseases that people have, I mean, children, right, for whatsoever reason. And then it results in hypertension that further damages the kidney. So we see those two. Yes, we see those two.
Okay. So let's talk about the diagnosis. What tests are commonly used to detect kidney diseases? Okay. Doc.
Okay, fine. So typically when somebody comes in, would recommend you start with a urine test, right? A simple routine urine exam, and then we'll be looking for certain parameters like protein in the urine. Remember, we said the kidney is a sieve. It should keep certain things that the body needs. The body needs those proteins, that particular type of protein. It needs it, so that should stay in the blood, right? But if the sieve is damaged and becomes wider than it should, the pores of the sieve, then definitely you have those proteins leaking out.
Right.
And it will give you an indication that there's something wrong with the filter. The pores are open up, right? And then there are blood tests that could be done. BU creatinine, I mean.
Right. I think Noah is here. He does a lot of the tests.
Yeah, so I wanted him to take that.
So Noah, yes, speak to that. What are the tests that people actually
So so in addition to the urine test, that's the urinalysis, we also recommend kidney function test.
Okay.
That's a blood test, and also urine albumin creatinine ratio test. So we do this test together to assess the kidney function.
Okay.
If they are functioning properly. There are some parameters we look at. If you take the kidney function test, for instance, we look at how well the body is able to filter proteins that are being taken, and also the activities of the muscles. When they go through their activities, they also produce substances, how well these substances are being filtered from the blood. All these helps in diagnosing whether the kidney is functioning properly or not. We also, in that same kidney function test, we look at the electrolytes. These electrolytes helps in the balance of it helps in homeostasis of the body, and also
what's that?
So your body should be at a certain balance in terms of the ions and also the water that you have in your body.
Right.
So this test measures these parameters to assess the function of the kidney.
Okay.
And also the urine in urine, protein mostly shouldn't be found in urine. So the urine albumin creatinine ratio helps to also assess whether your kidney is functioning properly or not. So we use that to assess whether there's been a lot of proteins being filtered out of your kidneys or through the body. So these two tests, a kidney function test and urine albumin creatinine ratio test to
but
assess.
How often should somebody test for, check their kidney function, especially those at risk? How often should they do that?
Well, I always recommend that as a healthy person who have not probably identified any of these symptoms, as we mentioned, it's silent. You should at least have 2 medical checkups in a year. That's at least. Okay. At least, maybe depending on your busy schedule and all that, at least you should have 2. But normally, I would advise patients to do that on a quarterly basis, just to make sure that you can catch it at its early stages.
Right.
Yes.
Okay. But can somebody just walk to any med lab and facility and say they are going to do a kidney test and a kidney function test and all of that, or they have to go through a doctor and then be recommended?
Oh yes. So I always say that when it comes to health, it's teamwork. So right from the doctor to the medical laboratory scientist to a pharmacy to nurses, it's a teamwork. So you can just walk in and request for a kidney function test. Same way, you can also go through, see a doctor first, and also assess you properly.
Okay. And
even probably if there are other tests that the doctor would recommend, you add it to the test. And my place like this, University of Ghana Medical Center, is a very good place, open facility to walk in any day for that very test.
All right, sure. So when we're talking about the doc, if you're listening, when we're talking about the symptoms, I wanted to ask, when you feel pains at your, the area where your kidneys are, does that also qualify as one of the symptoms for the disease or something like that?
Yes, it could be, but there are other kidney conditions that may not necessarily, at its onset, affect kidney function, right?
Okay.
That may cause pain. If you're talking about the back, yes, somewhere below the ribs, yes. But it would warrant investigation, right? You shouldn't sit down because there could be other things that would be related to the kidney. Not attended to could result in maybe either an acute or chronic kidney condition.
Okay. All right. So also, I think a very important thing we also have to talk about is about the whether kidney diseases are reversible if they are detected early. Are they?
Yes. So to add to the investigations, right? It's not easy to say yes and no. It will depend on the underlying condition, the underlying cause, right? So we'd also employ the role of ultrasound in addition to the urine and the blood that my colleague elaborated on.
Okay.
There's also an ultrasound scan that is done, and then there are certain features that are reported on that give information about kidney function, right? Especially in cases. So yes, if seen early, as with most things, yes, then it is partially reversible or reversible to an extent, right? Probably it will be arrested where it is and further decline will be prevented.
Okay.
Yes.
All right.
But with the late stages, usually, like the very, very late stages, usually it's permanent, right? Because if it's gone, it's gone. It's permanent, and then the focus would be on salvaging and then preserving whatever filtration capacity is left. Yes. So.
All right. Let's talk about prevention. Then we can go. I think that's the last part. So what practical steps can an individual take to be able to, protect their kidneys? Noah.
All right. So going back to fetch from the causes we earlier mentioned, so dehydration. So as much as possible, you make sure that you drink a lot of water.
Okay.
That has been required for a normal person to take. Also, the intake of alcohol. It's either you stop taking alcohol. I don't want to say take it in moderation, but just abstain from alcohol. Yes,
as much as possible.
As much as possible. And also make sure that you also take a balanced diet. Not too high proteins, not too less of proteins.
Right.
You should have a balanced diet. Yes, and it should be
help.
fine. Yes. Also, I should say lastly, my colleague mentioned medication, self-medication. Yes, it's something that is very common in this part of our world. We should try as much as possible to avoid self-medication.
Okay.
Yes, we should. I always say the slightest symptoms, just get to the nearest health facility and check yourself.
Right, check yourself. All right, Doc, let me come to you finally for your comments as well. I mean, how important is managing your blood pressure and blood sugar levels in this, and how can people actually do that?
It's super important. It's paramount. So you've been diagnosed, you've met the criteria for hypertension, right? Visit a health facility, engage with the facility, and then you'll be managed, right? Lifestyle modifications, medications, and what have you. When you take those BP medications, they are known to be safe, right? At what dose they are known to be safe, at what dose that they should be prescribed at.
Right.
So you take them if it's the sugar, if you have to take oral medications or you have to inject insulin or whichever regimen is chosen for you, just stick to it. These medications have been around for a long while. Their safety profile has been investigated. And if there are kidney issues, you see, that is a difference between the medications that are given at the hospitals, right? We know that, okay, for this particular kidney condition, at this particular stage, give this amount of the BP medicine, reduce it, don't add this, add this. These are not safe. So somebody would say, okay, taking those BP, won't it further damage the kidneys? No. There are options that are friendly on the kidneys, right? Okay. And this is backed by data. So it's important. When the condition is there, address it, right? Approach it, address it. If there are any concerns you have, speak to your healthcare provider, right? Avoid unnecessary medications, drink water. I'm just reiterating what my colleague says. Regular exercise, control sugar, blood pressure, and then
Okay. All right. Thank you very much, gentlemen, for your time, and thanks for sharing your insights with us this morning. We're really grateful that you came. Doc, thank you very much for your time. All right. And Noah, thank you too. Really grateful that you came. All right, so Dr. Charles Ayagbe is a medical doctor, and also Noah is a medlab scientist. Really, his name is Noah Kwesi Nate. Yes, he's a medlab scientist at UGMC. And these are the two individuals who joined me this morning for our conversations right here on the Business Breakfast on Z. We've spoken about kidney diseases, and that is because we care about your health. So let's take care of our health and also make sure that we put in place some of the things that have been discussed this morning so that we can avoid any of those diseases. We don't want any GoFundMe, anything. Yes, so very important. Thank you very much for listening to us right from 6:15 till now. We're back again tomorrow, on Monday, for some more interesting conversations. My name is Nitrebi Hammond. Until then, take care of yourself, and I'll see you next week. Up next is a